So everyone in here has chickens of some type, or poultry, or ducks, or, well, poultry would be all of those. Ducks, geese. How many has at least one chicken? 50 chickens. More than 50. More than 100. How many do you have? More than 100. Less than 1,000? More than 100? Less than 1,000? Okay, all right. All right, I'm going to talk to you a little bit about some of the calls that I've received. I am the Extension Poultry Health Veterinarian. I get a lot of phone calls, lots of questions, so hopefully this will help you out. Some of the things. Dr. Bailey and I tried to team this up a little bit. He spoke yesterday. I wasn't able to get here, even though I was on the program to speak yesterday. He should have talked on the diseases. I'm located at the Center of Excellence, Poultry Science, the University of Arkansas. I'm part of the Division of University of Arkansas Division of Agriculture Cooperative Extension Service. And I'm rarely in that building. I'm usually out in the field. So, some common problem calls. What do you think is the most common call, thinking about your own flocks, that I would get? Which one? ADR? Okay, goes right along with that one. All right, here's just a list of some of the common calls. Nutritional calls. I'll see if I can see. Now I'm red-blue colorblind, so I know this is going to be a red dot. So if you see it wandering about on the screen, I can lose it. Okay, injuries, and this has already been talked about. Pendulous crop, egg-bound, prolapse. Going along with that is an inflammation. Problems with eggs. Occasional call on frostbite. More and more we're getting calls on buffalo gnats, lameness and paralysis, bumblefoot, parasites. But as you can see, disease problems is way down the list, really. Most of these birds are reasonably healthy most of the time. Now, the diseases I know Dr. Bailey talked about yesterday, I bet he talked about Mycoplasma. Okay, that is probably one of the biggest problems we see, because the birds may not show any clinical signs, but they have it. Okay, since the first of the year 2017, the most common call, what do you think? How many of you tried to treat your birds and had any success? Come on. Antibiotics is probably the most common call I get. And the question related to that is, where do I get them? Well, the first of the year, 2017, is when the Veterinary Feed Directive went into effect. You can no longer legally buy medications without a prescription. You cannot get a prescription unless you have a valid client-patient relationship with your veterinarian. Now, many veterinarians, when I was in veterinary school, I was kind of the oddball out because I wanted to work on poultry. All my colleagues didn't. Now, more and more colleagues are getting into poultry. So I would encourage you to develop a relationship with your veterinarian. They can help you a lot. So let's go on with here. One of the biggest problems, nutritional problems, lots of questions related to that. Many times individuals will want to feed their own birds their own formulation, and that's okay. What I would counsel you is that get all those ingredients put together, take a look at that, contact one of the universities, one of the poultry science departments, and say, this is what I'm doing, this many parts of this and this many parts of that, and see if they can kind of guide you and help you to get a balanced diet if you're going to do that. Now, the easiest method is to buy commercial feed. Most feed stores have some type of poultry feed. Usually they have a starter, they may have a grower or a maintenance diet. Those are all very well balanced, but there can be some problems. Now, well, let's go forward here. Wrong dot. Standing on the head or flipping over. I get a call on that. That is usually a vitamin deficiency. Now, that does not mean that the feed itself is deficient in the vitamins. Many times we could have an infection in the animal, in the bird, that would cause them not to be able to absorb what they need. Or if we've got some type of mycotoxin or some type of fungus growing in the feed, it could interfere with fat. We could have rancidity of fat, not be able to absorb those fat-soluble vitamins, because vitamin E is typically involved in that. Rubbery beak. going along with crooked toes and our legs, such as we see these bow legs here. Now this can be rickets. Rickets is a calcium phosphorus imbalance or a vitamin D deficiency, or all of those together. Vitamin D is a fat-soluble vitamin. If there is rancidity of the fat or not enough in there, they may be short and develop that. Poor feathering, and then no production. Many times the no or very low production is due to low protein feed. Feeding them just scratch grains, you're not going to get as good a production as if you're on commercial layer diet, some type of formulated feed. Okay, again, rickets, usually soft rubbery bones or beak. We see this most often in young birds, the fast-growing birds. Now, when the chick hatches, the first few days, their bones are not real strong anyway. So it's very critical to get that calcium and phosphorus in there and the vitamin D. Vitamin E is for deficiency is poor growth, poor reproduction. We can get some paralysis, what we call encephalomyelitis. It's an imbalance, and you may notice the birds are just a little wobbly. They act kind of like they're drunk. And this can be from vitamin E deficiency. Thiamine is another one. Vitamin A is involved in poor growth if it's low. If there's a deficiency, you can see plaques, sometimes watery eyes and nostrils. Don't confuse that, though, with an actual infection with such as Mycoplasma. Riboflavin can cause some down problems and dermatitis, just show you some others. And you can see here there's a whole host of others, biotin, pantothenic acid, all kinds of different things. Feeding a good commercially prepared diet is the way to get around this. If you need a little insurance on it, you could use a vitamin mineral supplement in the water. That would help you out. And a lot of individuals do that. Okay, predation is another common call that I get. And this can be in birds that are confined or birds that are free range. Many times birds that are free ranging out, you'll never know anything about it. They're just missing. See them one day and then that's it. They're gone. Okay? Or you can have birds that are injured. Now, out in the rural areas, you may have more predators, raccoons, possums. But even in the city, as this hobby continues to grow, there are predators in the city. Coyotes, dogs, neighborhood cats, feral cats. What was the other one? Humans.
We actually had somebody who was missing chickens, and so she did everything and then put a lock on the door and she stopped losing chickens.
My grandmother used to say there's nothing lower than a chicken thief. Now, I put this up here. Some predators have immunity. Raptors, you can't do anything about them. And that's the hawks and the owls and the eagles and things like that. But here's some things to key you in on possibilities. Coyote, many times is the whole bird missing. See scattered feathers. A cat, young birds usually, or baby chicks. The dog, most of the time the dogs will just maul them. And those injuries are going to be on the very back of the bird. And it could be your own dog. Doesn't have to be the neighborhood dog or neighbor's dog. Fox, again, whole bird's missing. A hawk, many times they're just eating right on the site. A lot of individuals will like to put netting over their pens if they free range them. Sometimes the hawks and owls learn and they'll bump that netting, and as the birds fly up, they'll get them as they touch it. Possums, rats. What about missing eggs? What would you think? Snake, absolutely. And you don't even have to see it to know it's a snake. You can reach in the nest, it's all scaly. Immediately you know that it's a snake in there. You will remove your hand quickly. You'll do the same thing even if it's all furry in there. And it's probably just your cat, but you don't know that. You don't even have to look. You immediately try to run into something getting out of there. Okay, as far as predation, some of the things you can do to prevent that is you can use smaller wires such as hardware cloth. Solid floors will help. You can bury the wire around the pen, usually about a foot deep, bury it on an angle going out. Of course, electric wire around the pen, always remember to cut that off before you go in. Same thing with the electric fence. Netting over the range area, this does help. Some of these deer nets or wire nets. Or you can have guardians, like a guard dog. The thing to remember on that is the dog is not always telling you if they're guarding your chickens or their chickens. Cats, I don't know how your cats are. Mine, they guard the feed bowl mainly. Okay, injuries. Many times these injuries are a result of trauma inflicted by predators, but it can also be trauma that you might accidentally inflict. You could shut the door on them or step on them accidentally. Very common when you have lots of baby chicks in a pen, you get in there, so use care when you go in there. Fractures, we can see all kinds of fractures. This is a radiograph like in the leg or wing, fracture of the beak. What are we going to see as far as signs? With a leg fracture, typically there's inability to walk. They may be standing on one leg. Okay? They may be holding that leg up that's injured. The one they're standing on is not the one that's injured. You really need a radiograph or an x-ray to see how bad the injury is. Now, that injury could be something like the leg's just been stretched a little bit longer than it should be. Maybe dislocated. It could actually be a fracture. With the wing, of course, inability to fly. Most of the time in chickens, that wing's going to droop because we don't see that much flying in the adult chickens. Now, in the baby chicks and the young adults, they will fly. Hanging down a little lower than normal. And again, could be even dragging. Sometimes this is not going to be an actual fracture. It's just been dislocated so severely that there's a lot of nerve damage in the wing. A radiograph will tell you, which is an x-ray, the beak, you're going to be able to see that fracture of the beak. It may be just a crack. Now, the beak itself in a bird is living tissue. The horn covering material on it is very, very similar to your fingernail, but underneath that it's living tissue, and there's actually bone in that beak. So the fracture can be a fracture that affects just the covering, which we call the rhamphtheca, which is like the nail, your nail or horn color. You may see flakes or cracks in it, or it could actually be a fracture down into the bone itself. They're not going to be very good at eating. They may peck at a few things like that, pick it up. Some other things. Now, treatment. How do we treat these? Well, leg and wing fractures, you can use a splint. You can bandage it up. If the bone is sticking through the skin, then it's a little different story. It's a compound fracture. Okay? May need sutures there. Possibility that there's amputation going to be involved if it's severe enough and the tissue is devitalized too much. The bones in a bird are very, very thin. They're very strong, but they're thin. Many of the long bones are hollow. The first wing of the bone in a chicken is air-filled, about 1/3 to maybe 40% out. Communicates actually with the respiratory system of the bird. One of the air sacs invades that bone. So in addition to a wing fracture, the bird could develop a pneumonia from that. So, beak may have to have some antibiotics if we have a pneumonia involved in there. Beak fractures, dental acrylics, the veterinarian can use dental acrylics, works really, really good. Now, in a desperate situation, you could use super glue. Okay, hoof acrylics, some of the resin compounds, all of those can work, but those would be just a temporary. The biggest problem with that is you want to make sure that area is cleaned up. You may be able to treat that fracture if it's just of the covering, the rhamphtheca, the horn covering, with nothing more than using a Dremel tool or a little fingernail file, just cleaning that up really good. Now, prevention on these, naturally predator control, prevent fighting. If there's more than one rooster in a pen, they may fight. And one of them is usually better at it than the other one. Repair and maintenance of your pens and coops, and then just good care. What is the best care you can give your birds? What's the one thing you can do for them every day that no one else can do? And I bet you do it more than once a day. Check on them. Absolutely. Okay? You are the first line of defense in diseases and prevention of injuries and everything else and all these problems, because you will know more about your birds than anyone else because you go check on them. How many go out and check their birds at night? All right. How many check their birds more than once a day? How many go sit in the pen with them and have their morning coffee? There's help for you. No. When I was a kid, we had chickens. And we had an incubator, a big round metal incubator. It was my job to turn the eggs. And I had to turn the eggs 3 times a day, first thing in the morning, then usually when I got in at school, and then last thing at night before I go to bed. And it's 21 days on the incubation of those eggs. And I realized that watching Lon Chaney Jr.'s The Wolf Man was a real bad idea when I had to go down there to change over the incubator egg. Okay, here's some of the bandaging. These are procedures. This is called a wrap here, and you can wrap this wing up. The veterinarian may need to put a pin in it if it's a severe enough fracture. Okay, the beak, you can see some of these acrylics. They do a really, really good job. Now, will the beak heal without being repaired? If it's not too severe, it will, but it may be damaged. You may have curvature to it. It's the same thing of like the bones. Okay, if a bird has a broken wing and nothing catches that bird, the thing to remember is that in the wild situation, a bird that shows an injury is a meal. But for a chicken that we have kept up in a pen, we have a wing fracture there, it may go ahead and heal on its own, but there's going to be some type of deformation there. May not be able to use that wing at all. It may have the bones overlapping, all kinds of things. Now, years ago, doing a lot of diagnostic medicine and looking through and dissecting birds out and animals and things like that, you would find old fractures. And many times they'll go, well, this parrot's never had a broken wing. But yet you're looking in there and going, well, this wing's been broken 2 or 3 times. But it healed up on its own because it wasn't a severe enough fracture. But I would counsel you that if you get a bird that has a fracture, it's a really good idea to get a radiograph on it from your veterinarian. Have a look at that. Okay, predator injuries. And I put some things in here. It can be just feather loss, as you see here. This is probably a dog. We may have torn skin. Many of these will heal up. You can use a little topical antibiotics. Bird skin heals very slowly. In fact, birds heal in general very slowly when it comes to the skin. Now, bones takes about 3 weeks, and they heal up, which is pretty fast. But when we get these severe skin lesions here, like right here, that may take months to heal. Now, you wouldn't think it would, but it will. The foot lesions, if we have a broken toenail, that toenail usually be out of there in just 2 or 3 weeks. Here you can see a small injury. Now this one right here is going to take longer, and there's going to be deformation here of the skin. Depending on the injury, is going to determine the treatment. Many times you will see just a little small injury there, a little scab, and you just notice it, and it's healing up on its own. And the area that's going to be damaged will be the comb and the wattles here, possibly even the earlobes. Now, if it's a severe enough lesion, such as we have here, a laceration, it may require sutures. Put that back together. So you can see if you heal this up, this bird may have a permanent smile time you stretch the skin that far. Severe wounds may require antibiotics, more than just topical antibiotics. The reason for that is because of bacterial contamination. Cats carry things on their claws. They may do a puncture wound. Puncture wounds are a little more different, or a little difficult to treat, shall we say. Okay, now, here's a picture of a chicken that got attacked by a dog. And as you can see, we have a huge, huge area that's affected, to the point that we really couldn't go in here and suture. There was nothing to suture or stitch, put back together. It was that severe. The owner was extremely dedicated. So we went into a treatment protocol where I told her to basically irrigate this area, keep it clean, use antiseptics on it, disinfectants, and let's keep this clean, debride the area. She was a nurse, and she worked with this bird. Now here's the lesion. Right there is the scab. Now we still have feather loss, and a lot of that feather loss will never return. We had that much damage. But there's the scab right there, and there's how big the lesion was. 4 months. She treated it every day. Yes. What she was doing is she was using saline, and saline works very well just to keep it clean. And then she would coat it with an antibiotic, topical antibiotic, try to keep it moist. But then she would clean it off because the tissue is going to curl up at the edges and dry up until we could get a good scab forming there. She just used topical antibiotics on this bird. At the time, she was using the triple antibiotics. The hardest thing for her is that it took so long, and 4 months is a long time. And we're still not done, but it shows you that it will heal over time. I honestly thought that this bird probably I thought we were going to have to euthanize this bird. It was severe enough. Okay, if you lose a lot of feathers, as was asked here, this area here, as long as it's out of a draft, most of the birds do reasonably well as long as they're out of a draft. Now, if we've got tremendous feather loss, they need to be in a little more enclosed area because they are going to lose that heat just by convection, radiation. Okay, a pendulous crop. A pendulous crop is where the crop becomes distended. Now, very commonly seen in some of the hand-fed pet birds in the parrot species, sour crop as they call it. In chickens, we occasionally see it. Usually it's from fibrous tissue, from a fibrous material that they've eaten. We'll have fluid in there. There may be some feed in there. It tends to sour, fill up with gas. They've got this huge balloon-like structure in front of them. Now, the crop itself, what happens is it loses the ability to contract. The crop is just basically a pouch on the esophagus. And food goes in there, it's temporary storage, so the birds can run out from cover, eat a few things, swallow some down, and then store up some, get back in the cover before a predator gets them. But it'll lose the ability to contract. The muscle tone can be damaged, and so it just dilates and gets bigger and bigger. Now, coarse fibrous feed, over-consuming of feed or water, birds that have gone without water for a period of time, they're going to have a huge bulging crop because they're just engorging on water. There is a parasite called capillaria that gets in the crop itself in the wall, in the lining. May see this occasionally, causing a pendulous crop. Of course, sour crop, this is where the food and everything gets really soured. May get impacted. If it's real dry feed and they don't have any water, you may get what's called just a lith, which is a stone-like structure. Marek's. Marek's typically we see is a disease problem causing problems in the legs, paralysis. But there may be involvement of the crop, so it slows down. There is some genetic predisposition in some species, some types. We know this in some breeds of turkeys. And then unknown. Now, how do we treat it? Well, you have to treat each one of these things here. You can change the feed, make sure they have plenty of feed and water in front of them, antihelminthics. If it's a sour crop or impacted, you may have to go in there surgically and remove that impaction. If it's just filled with fluid and everything else, many people will turn that bird upside down and just milk that crop out. The problem with that is that birds have a cleft palate, so you may get some up in the sinuses. We don't want them to get inhalation pneumonia. Marek's, there's really not much we can do for that one except vaccinate when the birds are very, very young, typically day of age. Genetic predisposition, that would be just a matter of keeping good records, and everybody in here keeps good records on their birds, right? Just humor me and say yes. Okay? Okay, the vaccine that we use, the vaccine commonly used for Marek's, is what's called HVT Marek's, and that's herpes virus of turkeys. It is a virus that we got from turkeys. We use that to vaccinate the chickens. There are a couple of others that are out there. But Marek's disease is such that we vaccinate so early because we don't really, in essence, prevent them from getting the disease. We prevent the side effects of these, the lesions. Most common lesion is where we have lymphocytic infiltration of the nerves of the leg, possibly even the wing or the neck itself. But it's a matter of exposure. Now, we consider Marek's disease is pretty much everywhere. If there's poultry, there's Marek's virus there. With that said, if you have birds that you don't vaccinate them, could they be exposed and never develop the lesions? Absolutely. And you may see some differences in your breeds of birds. You may have birds, and you probably have noticed this over time if you keep really good records, there'll be some birds that always have problems. They seem to be more prone to scaly leg mites, for example. They're more prone to getting Marek's disease. They're more prone to getting pox and things like that. So it does vary. But that would be exposing those birds to a small amount of the virus. I do not. I work as the extension veterinarian, basically in education. Now, the vaccines that are available, the Marek's vaccine is given by injection. Many of the other vaccines can be given in the water. And as we see the hobby increasing, which it is one of the fastest growing hobbies in the country, beekeeping is another one. As we see that increase, more and more veterinarians are working on doing practice. We may see a change in how some of the vaccines that are prepared. Typically now you buy a bottle of vaccine and there's how many doses in it? 1,000 or more, okay? And that's a lot. We may see that the companies may see if the market continues to get like it is, they may make smaller doses so that the individual could buy then vaccinate them.
Now, okay, so right now you can't really vaccinate your own.
You can, you just have to get the vaccine. The biggest problem with it, for example, with Marek's disease, the vaccine is in such large quantities, you need to vaccinate everything at day of hatch. So if you've only hatched 30 birds, and let's say you buy a vial of vaccine that has 1,000 doses, for example, you've got to use it within just a couple of hours or less. So you vaccinate 30 birds and then you might wait again, vaccinate. So we may see a change in that, who knows? As far as I know, you can buy most vaccines without a prescription from the poultry company, at least poultry vaccines. You'd have to check with the company. A lot of the things have changed with the VFD changing everything. It may have affected some things on that. Not Marek's. Now, Marek's has to be given by injection. Now, many of the vaccines we have can be used by, it depends on the method route you want to go. We use them, in the commercial industry, vaccines are given in the egg to vaccinate that chick before it hatches. And they will use several things. Some of those same vaccines can be given in the water or sprayed. Others are given by eye drop in the eye. So it varies depending on the vaccine and how it's prepared and what agent we're vaccinating for. Most commonly in the water we vaccinate, for example, in the commercial industry, one of the biggest problems in the table egg industry that they want to prevent is anything that causes a decrease in egg production. And so they vaccinate repetitively to keep them boosted up with a vaccine that is Newcastle bronchitis. And that's typically given by spray or in the water. Now there's other methods that can be used. But the common methods of vaccination are vaccinating such as, for example, subcutaneously, wing web vaccination, eye drop, spray, in ovo in the egg, and then in the water. Okay, again, the signs would be, you will see this. You know, they may have an abnormal gait because it's so big, it's in front of them. Treatment, you can support the crop. In fact, there is someone that sells a crop bra. So you can put on these birds to help support that up there. Empty the crop and then try to correct the problem. Prevention would be naturally Marek's prevention, parasite prevention, and then good nutrition would help. Genetic predisposition, you're going to have to look at that. Okay, and here's a pendulous crop. Right here, you can see it. Now, is it going to hurt the bird? Over time, they may not be able to get enough nutrition in them, so they're going to lose tremendous amounts of weight. Dehydration, emaciation, possibly starvation, as it gets bigger and bigger. You may have to do a procedure where you reduce the size of the crop, but that could be done. Okay, egg binding or egg bound. How many have had birds that have been egg bound before? Okay. How did you treat it?
We haven't. She still walks like a penguin.
Okay, so she's still egg bound?
Well, but she was a penguin walker before she started laying eggs.
Okay, then it's probably not egg binding. Typically, we call what's referred to as a penguin-like stance. Now that means more upright. Now with egg binding, a lot of times they'll stay in the nest, they may prolapse, but you can see that egg. The cloaca is the terminal pouch of the GI tract. Has areas where the urinary tract, reproductive tract, and the gastrointestinal tract empty into it. The egg passes through that. And a lot of times a bird that's egg bound, you will see that egg at the very back. Now, they're losing energy and they're losing calcium. It's kind of like having just a tetany all over. So many times what you can do to treat the bird yourself is give them some calcium, just orally. And if nothing else, you can just take a calcium pill and grind it up, mix it with a little water, or even like a little orange juice. Get that down the bird. Give them a little bit of sugar or honey, give them a little energy, keep them in a quiet place. They may go ahead and pass that egg out. Now, why do they get egg bound? Okay, it can be too large of an egg. It can be an improper diet. Improper diet can be that they're too fat. Have that big fat pad. You can have soft shell eggs. Typically a soft shell egg is much, much harder for them to pass out. It's like a water balloon. Bird can be too small. Improper lighting. Commercially, or if you are doing anything to light stimulate your birds, if they're improperly lit to get them into production, they may produce an egg that they're not ready to produce as far as size-wise, and can get egg bound. Now, emergency or not, many times it's not an emergency when the bird's trying at the very beginning. It can become one because they're sitting there, they're exhausting themselves. Just think of it as a woman in labor for like 4 days. You know, they're wore out. Now, giving them an energy source and a little calcium supplementation, many times this will help them to go ahead and drop that egg on out. Manual manipulation or puncturing the egg. If you can see the egg, you can actually see it in their vent and it's soft shelled, you could puncture it, contents leak out and they'll drop that membrane out because it doesn't have a shell on it. Hard shell egg, I wouldn't puncture it because we don't get any damage there. Now, going in, as an emergency, going into the veterinarian, many times just a very light anesthesia relaxes that bird down and they can retrieve that egg. But you want to look at dietary correction. And here's a bird with it. Now, this can be egg binding. It can also be something else, egg yolk peritonitis. And I will mention, okay, let's go on here. Here you can see the egg right there. See it? Here's manual manipulation. You have to be careful doing this because you don't want to break that egg. Little KY jelly around there and just gentle traction. That egg may just pop right on out of there. Now, what's the problem with doing this? You may get a prolapse. The oviduct is prolapsed out, or the cloaca. Typically, you can just put that back in there. Your veterinarian, if it prolapses out and stays out, it's going to swell up. You can get cloacitis, or what we call, the old term is vent gleat. Some antibiotics on that, shrinking that down. Maybe have to do what's called a purse string suture, which would be a little suture running right around here. Let's go back on this on the egg yolk peritonitis. Okay. A chicken produces an egg about every 25 hours. That's how long it takes to produce that egg. Now, the heritage breeds, the purebred stock, whatever you want to call them, they typically will produce a clutch of eggs. That clutch may be 18 eggs, 24 eggs, 32 eggs, whatever it is. So they will produce that clutch of eggs and then they'll get broody. But however it's done, when that egg yolk is released from the ovary, it's picked up by the oviduct, by the funnel-shaped portion called the infundibulum. It's right in that part there, within the first few minutes of being released, that it's fertilized. The white spot that's on that egg yolk, that's the genetic material of the hen. If it's a fertile egg, it'll look more like a bullseye. But it has to be fertilized before we get the shell and the membranes and the egg white and everything else on there. So it's fertilized in the infundibulum. And what happens is the oviduct, when the follicle or the ovum or whatever you want to call it, when it's the egg yolk, called the follicle, when it's released from the ovary, it falls into a little area, we sometimes refer to that as the ovulation pocket. And the oviduct just swallows it up. If something happens to disturb that hen, or whatever it is causes that that follicle to fall out of that area, it may not be picked up and processed. It may be free in the body cavity. As long as it stays intact, usually it'll regress and be reabsorbed and okay. But what happens is sometimes it will rupture and then you have free egg yolk. Just kind of like breaking an egg yolk in a pan. And that will cause an inflammation, or we'll have an inflammatory response. It develop a peritonitis. Birds do not have a diaphragm, so there's no separation between the thoracic cavity and the abdominal cavity. So we get this peritonitis in there all over everything, and they will walk like this penguin stance. Most often we diagnose egg yolk peritonitis on necropsy because it usually does kill them. If treated early enough with antibiotics, you do have at least a chance of saving these birds. Okay, here's a prolapse. You can see it right there beginning. Now, the prolapse can be caused from straining the lay, an abnormal egg shape or size, poor nutrition, pecking order. If we get a prolapse and it's very small right after and it's not uncommon for that to evert just a small amount anyway for the egg when it's popping out of there. Many times birds will get to pecking at each other, and if they peck at this and this swells up, it can't go back inside of them. In fact, they may actually cannibalize each other, or well, they'll typically cannibalize one. We can get an infection there, and sometimes the bird's too fat and this prolapse comes out of there. They're going to act different. They're going to have an abnormal stance. They may want to stay in the dark, cower in the corner. They're going to walk differently. You may see this tissue on the outside of the vent. This will be cloacal tissue or even possibly oviductal tissue. Now, how do you treat it? If it's very, very early, you can clean it up. You should be able to just push it right back in there. It does very well. If it's late, it's a little harder, okay? You have to wash it, maybe use some antiseptic on it to clean it up, to sterilize it, which you would do. You may have to have debridement done. The veterinarian may have to trim off some of that tissue that's dead. And it's put back in. It's, in essence, a surgical procedure. And then sutures are placed in there. When it's this point here, it's really difficult. But early, it's not uncommon. Just push it back in there. Now, how do we prevent it? Prevent overweight hens, corrections in the management. Again, all these things, unbalanced diets. Cannibalism can be a problem when we have a prolapse. And what happens is that's just this big piece of tissue hanging out of there. The other birds pick at it, and it gets to bleed, and then more and more pick at it. Eventually, they cannibalize the bird. Okay, here's the egg yolk peritonitis on the inside. What happens, as you can see, this looks like cooked egg yolk. The body temperature of a chicken is about 105, maybe 107. So that egg yolk is just sort of there cooking. If they run a fever where it gets even higher, it'll look even more like this. But you can see this just looks sort of like cooked egg yolk. Now, again, it's that penguin-like stance. They waddle when they walk. Typically, it's found on necropsy. Now, a bird that has that stance, a veterinarian looking at that might do a puncture abdominal cystesis and drain out some fluid out of there. See, it's egg yolk. Treatment, when it's like this, it's hard. There's not much you can do once they get to this stage. Okay, one of the problems here that we see when we have the vent, if we have prolapse of it, we may get all these urates material. Birds do not produce urine like mammals. They produce a semi-solid material. It's kind of like toothpaste. You'll think about that later. That's probably the best description I can give you, is it's kind of like toothpaste. It's kind of gritty and all kinds of other things. But we call it urates. And what happens when we get some prolapse there, we may get an inflammation of the cloaca called a cloacitis. The old name is vent gleat. And what will happen when we get this inflammation here, we get scalding, lose feathers. You'll see the urates build up. It'll look like sand there. And that's a problem. Now, we get all kinds of bacteria there. Typically, there'll be some yeast involved in that, some fungi, maybe some protozoans all in there. But anyway, all these things get involved in there, and we can get it secondary to other problems. They have a tremendous odor. If you ever see it and smell it, you won't forget it. The skin itself may be thickened. It's basically a urine scald. If it were a mammal, we would consider it a urine scald. We'll see feather loss, pasting of the feathers or soiling of the feathers, because as that skin builds up, the fecal material collects on there. So the urates are on the feathers. We may even see some blood in there, in the feces, or even possibly a diarrhea going along with it. So how do we treat it? We want to clean that area. We may have to remove the feathers. This is something you could do yourself. You can use antibacterials and or antifungals topical on this area. Cleaning it, I'd use warm, mild soap like betadine, a betadine soap, clean that area up, and then maybe have to pluck out a few more feathers, not like the bird can spare very many, considering they've lost so many. And you can treat that with some antibacterials. Prevention, best practices, good management, stress control. Y'all all practice stress control in your chickens, right? You don't threaten them when they don't lay eggs. My father did. He said his philosophy was he would hang a hatchet up over the pen. He said, they'll get the point. Okay, but you can see, all right, see all these feathers here? This is healed up, but this skin is still a little thickened, and we've had some feathered. A lot of those feathers won't come back because the skin's been damaged. So let's move on here. Eggs, I get questions on this, on why aren't they laying eggs, and there's all kinds of abnormalities. No production. This time of year can be lack of supplemental light. Chicken needs about 16 hours, 15 and a half, 16 hours to drop that egg, produce that egg, supplemental light. We're not getting that much daylight. They may be molting. Predators can be getting in there. Of course, diseases, when they're not doing right, they quit laying eggs. Could be their diet. They may be eating eggs. Now, one thing I tell individuals is that normal, it takes about 25 hours. The clock's got to rewind periodically. But you may see a change in the number of eggs. There'll be 10 eggs today, 10 eggs tomorrow, then there's 8 eggs, 9 eggs, 10 eggs. Well, these gals in here are taking a break. My dad would go, you better get back up to production there. You know? Okay, problems in the eggs. One of the calls that I get that happens periodically is I get a call and they say, my chickens have worms. How do you know your chickens have worms? I've seen the worms. What, did you see them in the droppings? No, I saw it in the egg. Oh, wow, I'm not eating eggs in the morning. Now, actually, there is a worm in the egg. Now, remember I mentioned about when the egg yolk, the follicle's released from the ovary, it goes in that little pocket area there, and the oviduct swallows it up? Well, what happens on this is the roundworms microscopically are migrating around through the tissues, and they all basically go and congregate in the intestinal tract and grow up and be adults. Some of them might get lost, and occasionally one of them will get lost and grow up and be an adult in the body cavity. And it just happens to be up in that area when that follicle's released, and the oviduct swallows it up too and processes it. So along with the egg yolk, you have an egg that's got a worm in it, which would be really good for diet control, I think. Now, other calls, white band on the egg. Well, maybe contact between the eggs and the uterus. 2 eggs at the same time, and they'll recalcify. Stress. I put in here bronchitis. Infectious bronchitis does cause enough stress on the hens that you may see some lumps and bumps on the eggshell. Typically, one thing I see with that is about 3 weeks after they've had the infection, you break the egg in the frying pan, and it just kind of runs all over the pan like it's about a month-old egg, and it's a fresh egg. That's usually from that one. A green yolk. Anybody ever seen that? Okay, that's gossypol from cottonseed meal. Just feed that, serve that with ham and green eggs and ham. Okay, odd shapes. And there are all kinds of blood on the shell. Okay, there can be blood on the shell because there's vent pecking, maybe cannibalism, maybe overcrowding. Maybe it's a real large egg and an overweight hen, and it's caused a problem coming through there. We can have cracks on it that are mended over. Typically, it's an older hen. What else? Blood spot in the egg, or a meat spot in there. Anyone seen those in their eggs? Okay, what causes those? It can be stress. It can be disturbance. That follicle, we go back to the egg anatomy here and the ovarian reproductive system. That follicle, when it's released, there's a little point, a covering called the stigma, and that tears open, and the follicle's just released out. Occasionally, there'll be a little blood vessel that grows across that. There'll be a little teeny tiny drop of blood gets in there. That's where the blood spot comes in. If it's a little piece of tissue, then it's a meat spot. Tissue's released in the egg. Here it's at the stigma. This is there. Now, low vitamins, mold in the feed, lots of different things. Stress is a big one. Stress causes lots of things, right? For all of us, stress eventually is going to kill us. A bunch of other things probably. Okay, you may have a healed eggshell, and it gets broken in the uterus. The egg spends about 20 hours in the part of the oviduct called the uterus, and there calcification takes place. If it gets broken, it may still have time to heal up, so to speak, as more calcium is placed on it. And you may have a egg that has all these little spackling on it, so to speak. All right, watery albumin, I mentioned that, bronchitis. Occasionally we'll have some reactions to vaccines. There can be older hens. Soft shell eggs, typically that's a calcium phosphorus imbalance. I put in here parasites because it's nutrition competition there. So let's look at some of the eggs. There's some odd ones. There's blood on the egg. There's one that you can see that there's a crack. Here it's contacted another one. There's a blood spot. That's just not appetizing at all, is it? Here's some wrinkly eggs. Oh, you can still eat it, yeah. One reason for scrambling your eggs, so you never know what's in them, you know. Scramble them all up, put enough hot sauce on there, and go, all right, I'm good to go here. You can see these eggs here are different shaped. Here's some spots out in the albumin. That egg just doesn't look appetizing either. I put that in there, okay? All right, frostbite. I got these photos here from Bridge McCree at Delaware. This is frostbite. Now, our first speaker mentioned to have rose combs. In a cold climate, these little points on the comb might freeze. They typically will get some coloration like this, or they may get darkened, and then they'll dry up and fall off. Okay, and then you have this comb. So, cause low temperature in a draft, they may get wet. Many individuals in a cold climate will put Vaseline on those combs, and that works. That does help. Okay, if it's in the toes, they may walk abnormally, because if it gets cold enough, it can freeze their toes as well. You may have discolored areas of the comb or the wattles. How do you treat it? Well, most people want to just get out there with a hair dryer, thaw it out. No, that's not best. Okay, you don't want to be cutting or anything. May have to resort to amputation. You don't want to debride this. Most of the time, they'll just fall off like that. Okay, and here you can see these are little stubby toes where the toes got there. All right, what this tells me is that you need a little more information on management. Keeping them out of the draft. May want to put a heat lamp in there. Prevent drafts. Extra layer bedding. Put deep litter in there. How many use wood shavings for their litter? How many use sand? No one uses sand? That was my father's favorite litter. And it was my job to haul the sand by the wheelbarrow load. We'd clean out the pens. I'd take a wheelbarrow load of sand, take it down to the creek. You dump that downstream. And then I'd get a wheelbarrow load of sand upstream and come up, put it in there. I think he did that just to give me something to do. It was like a half mile to the creek, you know. Because we finally went to wood shavings, and then he didn't have clean pens at all. I just had to do all that. But deep litter, this will give you that added insulation. And I put up here breed selection. I'll go back to that one. Where is the red? Oh, there it is. Sorry about that. I'm also red-green colorblind. I'm a real thrill driving through the cities, let me tell you. With all the stoplights, like, I don't know. Nobody's coming to say. All right. Breed selection. Pick birds that have smaller combs. Black flies, buffalo gnats, what do you want to call them? Turkey gnats. No-see-ums. Now, there's a bunch of these different species. We are seeing an increase in these, at least in Arkansas. Now, they will get on people. They will bite you. Now, in birds, sometimes they'll actually kill the poultry. They will worry them so much. And I get calls on this. Typically, calls are in the spring when we have a lot of free-flowing water. They may cause an anaphylactic shock, and you get blood loss. Now, they transmit a bunch of different things. Let's look at them. All right. Each of these dark spots in that whole series there, that's a bite from one no-see-um. You can see they're getting pretty severe out here, and this bird was pretty much just annoyed to death. Look at the wing. We've pulled the feathers out here. You see all those spots? All those are bites. Now, what will the birds do? They're going to seek a dark area. They're going to stay in the dark, and you're just going to wonder what's the matter when they're afraid to come out. Well, that's understandable. So how do we treat them? You can keep the birds in the dark. You can put out a fan on them, a high-speed fan to keep, because these little gnats aren't that strong of a flyer as far as against the wind. Repellent sprays, a lot of individuals will use take oil and put it on an aluminum surface, put that out in the sunlight. You can take fly strips, put them out in the sunlight, and the gnats, the black flies, will land on those and get stuck. Now, Skin So Soft lotion, lots of individuals use that. They have all kinds of things they use, that individuals use. They say Camphophenique and WD-40. I'm like, you spray your birds with WD-40? Well, they won't squeak as they walk, I mean. But they only put that on their comb, and I thought, my grandmother would love you. She loved all kinds of treatments like that. You can take these yellow fly strips. Easiest thing is take an aluminum pie plate, smear it with Vaseline or oil, and stick it out in the sunlight. But what they do is it's a surface for them to light on. They light there and get stuck. In the far north, I've been told that lumberjacks wear these aluminum hard hats, and they just smear Vaseline on it so the no-see-ums don't eat them up. You can use some sprays. I'd use a spray out there. Paralysis or lack of mobility, things to think about. It could be Marek's disease. Now, on Marek's disease, I'm not sure if Dr. Bailey talked about that much or not. But I can tell you this, in some of these breeds of birds, you may have 5 breeds of birds and have Marek's disease crop up in only one of those breeds. Now, does that mean the other birds are immune to it? Quite probable. You may have like this little silver seabright hen here, she's got it. Some of the others didn't have it. I would save my stock back from those others because there may be some genetic predisposition. Here we've got it. You have to consider that maybe an injury. Most of the time, this paralysis is an injury. Could be nutritional. There's a disease called Avian Encephalomyelitis. We do see that occasionally, and they'll be paralyzed. Bumblefoot. How many have seen Bumblefoot? Have you treated it? It's a toughie. Just imagine the bird, how big of a pain it is to them. No? All right. What do we see with this? Now, this is the term we use. This is one of those veterinary terms we get to use called Podo Dermatitis. It's kind of like telling somebody their horse has epistaxis. Your horse has epistaxis. If somebody punches you in the nose hard enough, you'll probably get epistaxis too. That's a nosebleed. All right. This is the term Bumblefoot. What happens is there's some type of injury here to the foot pad, and we'll get an infection in there, with or without a song. That's the Bumblefoot song. That's it. You'll remember that. Now, it can be a scrape. It's a bacterial infection. Now, the signs, typically it's some degree of lameness or limping. Limping along, and I can sympathize with that. I have a heel spur. Boy, talk about limping. Swelling of the foot pad. You may notice an area in the center that looks discolored in the center of that foot pad. And that's usually the wound site. It may be reddish color. It may look like dried cheese. Detection, regular inspection of the bird's feet. How do you treat it? Pretty much, there are about 8 grades of Podo Dermatitis or Bumblefoot. Real early, you may have some success with cleaning this and just kind of bandaging the foot. Maybe a little topical antibiotic. The biggest problem is once it reaches a certain stage, it's going to take surgical curettage to get it out of there. It may invade up into the bone or into the tendons. You can try to prevent it by a litter and just reducing traumatic sources. Keep those purchased so they don't have big splinters in them, things like that. Surgery on it can be done. Veterinarians can do this. Many times it's a repetitive surgery, because you clean it up to a certain point, then may have to go back in later on and clean it up again. All right, I'm going to mention things. I'm going to wind up here. Recognizing the signs of illness in poultry, you are the first line of defense. Okay, now, if you're like me without your glasses, I'm lucky to tell that's even a chicken. Okay, temperature, I said about 105. There's the range. Heart rate, about 250. What's your normal resting heart rate right now? Hope it's better than 60. Yeah. Feeling weak? No. Okay, ours is probably what, about 65, 68? I teach avian anatomy at the university. I can guarantee you I can get this heart rate up almost to that on some of the students, depending on the test. Respiration, 15 to 30 per minute. Now, you're going to go in and look at your chickens. Catch the bird. Now, if you've got to run that bird all over the pen, that wheezing you hear is not from the bird. It's probably from you, okay? And that's probably not a sick bird. If it's outrunning you, hey, you're the one that needs a physical exam. No. All right, so you catch the bird and you look it over, and you're going to do an assessment of all the anatomy of the bird. And you've already done some of that assessment. It's standing on one leg. What would you think? Got an injury. It's got a leg problem. Okay? So you feel the heart rate. It's always fun as a veterinarian to listen to the heart rate. Heart sounds good. Oh, yeah. How many beats? Like I can hear that. You know, sounds like a jackhammer. But what are some other things you look at? Runny eyes, runny nose. Do you look in the ears? Do you know chickens have ears? They're like teenagers. They can hear, they don't listen. Okay? Sometimes they do listen. Those feathers that's covering over the ear, those are ear covert feathers. Their ear's just a little hole in the head, not magnificent structures like ours are. They have eyes. How many eyelids does a chicken have? It has two? So it's just got one eye? It's a pirate chicken? No. They have 6 eyelids. Now you know what? Amy would tell you the award that I won for years at the University of Arkansas. I won't say it, but for tormenting the students, I guess I should say. Okay, they have 6 eyelids. They have 3 per eye. They have an upper eyelid and a lower eyelid, and they have a third eyelid. So if you look at their eye, if you see something move across their eye, that's their eyelid. What color is a chicken's eye? Y'all got chickens. Y'all look at them. What color are their eyes? It's only creepy if one eye is one color and the other eye is a different color. You know? What color are their eyes? Purple? Yellow. Yellowy, chestnut color. Purple, they may have been hit in the eye. They'll need that patch. So, okay, here's the signs of disease in a bird. Depression. How do you tell when your chickens are depressed? In the commercial industry, we figure this sets in about 3 days before they go to market. No. All right, they may have a discharge, diarrhea. Now in ducks, just kind of discount this one because they sort of have that all the time. Coughing, sneezing, make sure it's not you coughing or sneezing. Inability to stand or walk, feather loss, thick scabs on or around the legs. Look at all these things. No appetite. Feathers broken. Parasites, you'll see those. Blisters. Now, as a veterinarian, we write all this down as ADR. That's ain't doing right. That saves from writing all these things down. Okay? Now, I know this was mentioned. I know Dr. Bailey mentioned biosecurity. Think of it as what level of protection you want to have for your birds. I list these 3 things here: communication, understanding, and attention to detail. And I don't know if this will work or not, but I will counsel you when you go home, get on YouTube, look up Black and Gus. Okay? And this is, I'll give you a little synopsis here. This individual was talking about, he was the newscaster, and he said, well, there wasn't much traffic moving on the Beltway this morning, but there was mooing on the Beltway. A tractor trailer hauling Black and Gus was stalled. And he shows a picture. The cow says, there's either Black or Gus. And his other co-anchor says, you know, maybe those cows named Black and Gus were actually Black Angus. And he has this look of like, no. And so he reads through it, and then you just see him go, yeah, they were Black and Gus, you know, they were Black Angus. So I use this to talk about biosecurity. Biosecurity is communication, understanding, and attention to detail. And I teach a lot of biosecurity classes, and these are the 3 big points. Just because we tell you to lock the doors to the chicken house, and you lock the door, but you leave the key in the door lock, well, you have some understanding of the principle. But the detail, take the key out, you know. So these 3 things. And if you go watch Black and Gus, you'll remember these, okay? You may laugh. All right, biosecurity, these 5 points, disease recognition, and who is the best at recognizing the disease? Each of you, okay? You're the first line of defense. If there's a problem, you can contact the state veterinarian's office, the extension office, and we will get you some help. The light cavalry will be there I'm in the heavy cavalry now. In fact, it's almost mechanized, like airlift, you know. As my doctor says, if I don't quit eating the pork and rib killer, it will be. Okay, disease recognition. Now, you know all the signs to look for, right? Lameness, broken feathers, diarrhea. Check the feces. Usually that's on you. You can check for that real easy. Don't bring diseases home with you. See, if you can do this, then you won't bring diseases home with you. Restrict visitors. I can't stress this enough. Clean and disinfect. Control vermin and pests. I'd put snakes in there too. Control them. What's one of the main reasons for controlling mice? They attract snakes. Is anyone here scared of snakes, or is it just me?
And how do you keep them from getting in there?
Smaller wire. Go out with a shotgun, try not to shoot your feet. And the last one, get help. Now, where can you get help? Your local veterinarian, extension service, okay? Biosecurity, practice it for your birds and your neighbor's birds. I want to stress that. All right, on the website, and I'll push this, we've got some fact sheets. There are some fact sheets over here as well. And that's great information. The extension service in all the states, you can get some information. We put together some things, biosecurity tips and things like that. I'll put this up here. We do have a free online course, okay? Now, this course is free. It's 5 modules. If you're expecting an MGM epic, don't go here. I know, because I put this together. So you'll be sorely disappointed. This is not even a B-grade Western, okay? This is a starting point. But it's free. Go to this website, and there's some stuff in there. And we're going to try to keep upgrading it. But there's information in there on anatomy and ventilation and lighting and nutrition and biosecurity and diseases and rules and regulations. Now, the rules and regulations in Arkansas. For example, in Fayetteville, Arkansas, you can have up to 20 chickens. It's classified as sustainable agriculture. Can't have any roosters. Think about that. Sustainability short term, okay? But you can also have, it's either 3 beehives or 2 beehives, and the other's miniature goats. You can have like 2 goats and 3 beehives, or 3 goats or whatever. So I thought, if I retire, I'll open up a landscape business, because with that many goats in town, you ought to be able to sell a lot of bushes. Attention to detail, okay? Now, you like that one? Yeah. All right, now we do have this out. It's called Avian Advice. This is geared more toward the commercial industry. Here's the website. Somewhere's the red dot. Trust me, it's tough being colorblind. My kids go, "You're going to wear that shirt? It's blue." And I'm like, "It's blue?" I thought it was white. Okay, here's the website for that. Now, the newest thing. In January, this is the plan. And you know how plans get derailed. The plan is we are going to start a quarterly newsletter for small flock owners. Now, we're going to have in there maybe an article or 2 on husbandry, maybe an article or 2 on breeds to showcase a breed, maybe an article or 2 on diseases, information about 4-H, and then I got a question here. I don't know what all is going to go in there. I know the editor, and he's the editor on the other one. Now, that's my email address. If you will send me your email, we will get you on the list. Okay? And we'll send it out. Now, that doesn't mean January 2nd, email me and go, where's the newsletter? January's got more than 2 days in it, so give me some time. We're going to try to send this out quarterly and try to make it, but I would greatly appreciate suggestions. If you send in something and say, hey, how about something? How about an article on this? And I'll email you back and go, thank you for volunteering to write. I appreciate you writing that article. Can we have that for the next issue? So we're going to try to do some things with it. Maybe give you some sources of help. Questions? Comments? I've had a lot of fun with it. Hopefully y'all have too.